Hello everyone. In this video, I will discuss about the developmental disturbances of the oral mucosa. These are included in the developmental disturbances of oral structure and paraoral structure. In the developmental disturbances of oral mucosa, there are two subtypes. First is Fordyce granules and focal epithelial hyperplasia. So I will discuss one by one. So first lesion is Fordyce granules. These are developmental anomaly which is characterized by heterotrophic collections of sebaceous glands. These Fordyce granules are otherwise known as Fordyce disease. It is not a disease of the oral mucosa. Rather, it is a developmental anomaly which is characterized by heterotrophic collection of sebaceous glands at various sites in the oral cavity. Then the etiology of Fordyce granules. It has been postulated that occurrence of sebaceous glands in the mouth, it may result from some inclusion of ectoderm having that potential of skin in the course of development of the maxillary and mandibular process during the embryonic life. So it is a developmental anomaly, so it occurs mostly in the embryonic life. And some other authors, they suggested that it can be due to some hormonal factors. For example, in puberty, it stimulates their development. During the puberty, there is a development of Fordyce granules. Then clinical features of Fordyce granules. These Fordyce granules, they appear as small yellow spots, either separated or forming large plaques, often projecting slightly above the surface of the tissue. In the picture you can see there is some elevations and some projections that are present on the buccal mucosa. These Fordyce granules found more frequently in a bilateral manner. It is present bilaterally and symmetrically, and it is present on the mucosa of the cheeks or the buccal mucosa opposite the molar tooth. These Fordyce granules can also occur on the inner surface of the lips. For example, in the retromolar region lateral to the anterior facial pillar, it can occasionally occur on the tongue region, gingiva, frenum and palate. In the first picture, there are some Fordyce granules are present on the upper lip. In the second picture, there are presence of Fordyce granules at the corner of the mouth or at the commissure of the mouth. These patients are mostly asymptomatic. These Fordyce granules, they do not produce any symptoms, and the patient feels some roughness to the mucosa. The buccal mucosa or any labial mucosa is not smooth. It is mostly roughness because of the elevation or the projection of these granules on the buccal mucosa. Next is histopathology of Fordyce granule or the microscopical features. These are closely similar to normal sebaceous glands found in the skin. In the histopathological picture, you see there are presence of sebaceous gland and presence of duct. There are presence of acinar lobules that are seen immediately beneath the epithelium. And the sebaceous cells, the morphology are the polygonal in shape and centrally located nuclei and abundant foamy cytoplasm. Sometimes one or more ducts, they open on the surface of the mucosa, and these ducts may show keratin plugging. Then the treatment of Fordyce granules. These sebaceous glands have no clinical or functional significance, so they require no treatment. Very rarely, a benign sebaceous gland adenoma may develop from the intraoral structure, and there is the occasional development of keratin-filled pseudocyst from the ducts of these sebaceous glands. So these are all about Fordyce granules. I have discussed the etiology, clinical features, histopathological features and treatment plan for the Fordyce granules. In the next video, I will discuss about the focal epithelial hyperplasia. I hope you like this video. Thank you so much.